Is it hard to access affordable, healthy food? Then listen carefully. Daryl Addison, an African-American inventor, has patented a process for growing food on demand. He called it Torpedo Pot. Torpedo Pot is a fully automated flower pot that gives you control over your plant's environment. All you do is add soil, seeds, and plants to the flower pot and watch it grow. Yes, Torpedo Pot grows the rest. Visit www.torpedopot.com.
So we have a story out of the Atlanta area at the Emory Decatur Hospital. So you have one of our young sisters that went to the hospital, and I want you to hear her story and how she received a bill from the hospital and she wasn't even seen. Let's go ahead and roll that clip.
Realized, I shouldn't be sitting in the emergency room for 7 hours.
But a couple of weeks later, this surprise came in her mailbox, a bill from the hospital for nearly $700.
I didn't get my vitals taken. Nobody called my name. I wasn't seen at all. I just came, sat in a chair for 7 hours and left.
Davis says she was convinced it was a mistake.
So I called them and they're like, it's hospital protocol. Even if you're just walking in and you're not seen. When you type in your social, that's it.
She says she was told it was an emergency room visit fee, or a facility fee as it's called in some cases, and it's often added to a person's total hospital bill, so it might not be as noticeable as it is in this case. An email sent to Davis by an Emory Patient Financial Services employee says, quote, "You get charged before you are seen, not for being seen."
Very reluctant to go into a hospital now. That's kind of like the last resort now. Seeing that they're able to bill you for random things, honestly, it doesn't make me want to go when I get injured, and that's not good.
So this hospital stated was extremely ignorant, because if you did not perform any kind of services on a person, how you could charge somebody for just sitting there? You didn't perform services. So what, you just sent her a bill out the blue? I mean, because I know good and well her insurance goes like, I'm not paying for that. You didn't do no services toward her. I mean, y'all scamming. That sounds like a scam to me, what this hospital is doing. This is why I don't like the privatized hospital system in America, because this is why your healthcare costs so much, is because it's privatized. You look at people like Canada, or you look at the UK, and they have basically their national health system, right? Things are, definitely a lot better for people, especially when I talk to people, that have that system, right? And they don't have to worry about paying for this, worry about any of that. I don't know why this silly backwards country don't go to a national, healthcare plan where everything is free. Listen, I've said this before. I am willing to pay more taxes to make that happen. I'm willing to do so. Just so when anybody go to the doctor, no matter who you are, you're not getting billed $700 for just sitting there. You understand? Or you can get any kind of health care, dental, vision, whatever you may need, it should be free. Because the silly people who are politicians in this country believe health care is something that should be based on how much money you have. And I don't agree with that whatsoever. Healthcare should be a right, no different than you have the right to eat food, right to free movement, right to, have some place to stay. I mean, I don't know why people in this country haven't got on that. I believe that's something that everybody, no matter where you come from, what culture you are, whatever, can get on accord and say, look, we want nationalized healthcare. We shouldn't be getting those $700 bills for sitting at the hospital. We should have that. No Obamacare isn't no nationalized health care. No, I mean, everything is free. No co-pays, no nothing. You'll put the insurance companies out of business. Great. But maybe they can cover things they wasn't covering before. Like, I don't know, maybe plastic surgery or cosmetic dentistry or whatever else they want to cover. Right? But this $700 bill is ridiculous. In Emory Decatur Hospital, you ought to feel ashamed of yourself. So brothers and sisters that live in that area, be careful. But I will tell y'all this. Just so you can save some money, go to urgent care. Emergency rooms, to me, should be only for true emergencies. If you have something that happened to you and you could walk in a place, go to urgent care. And if it's that bad at urgent care, they'll call the ambulance or something to come get you, right? But go to urgent care because the co-pays are lower at urgent care or on your insurance. Because the moment you go to the freaking hospital, you know, some of these co-pays could be $150 up to $200, $300 just for a copay when you can just go to an urgent care. And urgent care is in a lot of places, so consider using that. But leave me a comment, let me know what you think about the situation with our sister here being billed this kind of money at Emory Decatur Hospital. Those of you in the Atlanta area, be careful there. Living in America as a black person, you recognize there is one set of laws for you and one set of laws for those, especially in the white community. In our book, Passive Aggressive Racism in the System of White Supremacy, I take you through times in my life when I first started noticing white supremacy. We teach you how to recognize it, identify it, and also counter it in our book. This book is a beginner's course for those that are just starting to wake up and open their eyes to see the system of white supremacy. As a black American person, you must understand this system because this system is life or death to you. How you handle it, how you deal with it, it can affect your mental health if you don't understand this system. Pick up our book, Passive Aggressive Racism and the System of White Supremacy, today on Amazon.